First person that we have with us is Dr. Luke Cryley. He is a physical therapist at the Brooks County Health Center. And if I'm missing anything, Dr. Cryley, you can obviously add on to that. But yeah, we're excited to have him here. And so if you're a student listening, yeah, I hope that this is really helpful for you. So give me 1 second as I replace. Okay, Dr. Cryley, we're ready when you are.
Awesome. Okay. All right. Like Chantel said, my name is Luke Cryley. I'm a physical therapist at Brooks County Health Center. As you can see, why I am wearing a mask in the hospital setting right now. Everything's mandated. You still have to wear a mask. So if you have trouble hearing what I'm saying, or you can't understand what I'm trying to tell you, just someone speak up, raise your hand, and I'll talk a little louder, or try to pull the mask down a little bit. I'm good. Okay, perfect. Okay, so we're going to talk about physical therapy. So physical therapy is one of the fields within the medical field. It does require quite a bit of education. So to become a physical therapist, you have to go to 4 years of undergrad and get a bachelor's degree. Once you get your bachelor's degree, you then have to go on and get what they call a doctorate of physical therapy. That is a 3-year program, and it's a clinical doctorate. So, you can go by Dr. So-and-so once you have the degree, but you're not an MD, okay? Just like how other professions like a DMV or a DDS, there's different forms of doctorates. The physical therapy doctorate is a clinical doctorate. It's not a PhD or an MD like a medical doctor. So that's something we like to clarify with people. It's a doctorate, but it's not the doctorate that most people think of. So I went to Wichita State for my physical therapy program. There's numerous programs in the state of Kansas. There's Wichita State, KU, St. Mary's, Rockhurst. There's a variety of them, but they are very competitive to get into. So if you have any interest in getting into physical therapy, I'll kind of tell you a little bit about what it is. I can't necessarily see everyone in there, but, if you've had any sort of surgery in your past life and a broken bone, maybe fell off a horse or something along those lines, or maybe your mom or dad did, they might have went to what the doctor said you got to go to physical therapy. So physical therapy, if you kind of think about it as being a mechanic for the body, is pretty much what we do. If something's broken or not working well or not moving right, people come to us, and then we try to help them figure out why my knee doesn't bend well or why my back hurts. And we try to find strategies, usually through exercises or modalities, to try to help decrease pain and improve function. So, physical therapy has really made a big push since the whole opioid epidemic. So, pain pills became a problem. A lot of people were getting addicted. So doctors had to reduce how much pain pills they were giving people. And when you're still having a lot of pain and pain medications aren't working, a lot of times now people are being sent to physical therapy or pain management. So, physical therapy is a very up and coming profession. If you want a job and be able to pick a job where you want to go, physical therapist is going to allow you to do that. You can travel and work. You could probably come back to your hometown and work. Physical therapy it's on the rise, and it just every year it trends a little bit higher and higher. Physical therapy doesn't always just have to be about injury and post-surgical things. So, if someone is falling or losing their balance, they can come see a physical therapist to help decrease their fall risk. If someone maybe is just out of shape and they want to get back into shape, a little bit of help, they can come see a physical therapist. We are not personal trainers. So personal trainers typically work in a gym setting. They don't have quite the education we have. They don't quite have the anatomy background that we have, but, we still do a lot of the same things, a lot of strengthening, stretching, things along those lines. So there's really a variety of things you can do with a physical therapy degree. There's a lot of settings you can work in. I work in a rural critical access hospital. You could work at your own private practice. So if you wanted to open up your own practice, you can do that, just like how a veterinarian or a dentist does. Physical therapists do that all the time. Same your own clinic, run your own clinic, be very successful that way. You can work in a hospital setting like we do, and we have an outpatient gym. You can work in school settings. There's a lot of pediatric physical therapists. You can work with kids if you want to work with kids. If you just want to work with adults, you can work in nursing homes. You can work on inpatient rehab floors, work with paraplegics, quadriplegics, strokes. You name it. You can kind of pick what you want to do once you get into the degree and the therapy degree. So, there's a lot of options. You can also teach. So I currently teach up at Colby Community College for the physical therapy program. Getting some feedback. And I go up there and teach every week to their programs. So if teaching is something you want to do, you can still teach with physical therapy. Again, you just have a lot of opportunities to do kind of what you want within the field once you get into it. So, and if you're not really wanting to do all the schooling for physical therapy, there also is a program for physical therapy assistants, which you still get to do a lot of the same things PTs do. You just don't do the evaluations and such, but that's only a 2-year degree instead of having to go to school for 7. So, if you really think physical therapy is interesting, but you don't necessarily want to go to school for 7 years, look into a physical therapy assistant program. That's also a really good way to go. Same thing, jobs are on the rise, more people need them. With COVID and everything else, there's a lot of post-COVID weakness that we're seeing a lot of. So there'll always be jobs, there'll always be opportunities. So other than that, if you guys have more specific questions, I can freely answer those now.
Dr. Kriley, I don't see any on the chat, but I do have a question. So around in the Northwest, North Central Kansas area, what would you say a average pay range, or what's the relevance to pay that maybe someone in this industry could expect?
So out in our area where PTs are a little bit more limited and a little bit sought after, and where you have to work in regions where you're doing inpatient, outpatient, neuro rehab, you're going to get paid a little more. So, out in these part of the woods, you're probably thinking anywhere between 65 and 72 to start out with. And then if you can get graduate wages, that can go through there. The nice thing about physical therapy is you could have a full-time job, work Monday through Friday, and then you can go pick up home health on the weekend and, help pay back student loans, things like that. There's also student loan forgiveness programs that you do qualify for. So, if you came out to this part of the world, you'd be making 65 to 72, and then you're probably getting some help getting your loans paid off as well. If you go to bigger towns like Kansas City, Wichita, starting pay for an outpatient job is going to be around 55, a little bit less, but then you're only working on one specific thing. Out here, we're kind of a jack of all trades. Once you get to the bigger towns, you kind of specialize in what you specialize in.
So what is your background as far as, did you grow up in this area or?
I did. Yep. I'm from Stockton. I live just 15 miles down the road from here. And
what was your purpose in returning?
Oh, just the environment, the small town life. I spent 2 years in Kansas City area and I spent 4 years in Wichita and didn't really appreciate either one. So I knew I was coming back once I was done. So
sure. Yeah. So we see a lot of that. So there is one question. What type of classes, since this is a high school group that's listening in, and I'm sure they're all concerned about, hey, if I want to go into PT, what kind of classes could prepare me while I'm in high school even?
Anything beyond what your gen ed requirement for math and sciences are what you'll want to hit, because your prerequisites to get into PT school are pretty demanding. So you're going to have to take Physics 1, Physics 2, Chem 1, Chem 2, an advanced algebra class, an advanced math class, advanced anatomy. So anything that you can get a hold of or a head start with your biology, anatomy, mathematics will help you out once you get to college and then post-grad too.
Yeah, that sounds good. I assume this question is related to education, but what was the estimated cost?
At Wichita State, when I went through school, if you're an in-state resident with no scholarships of any sort, you're going to be looking right between 65 to 70,000 that's just for the physical therapy. And then you add in 4 years of undergrad. So student loan debt is one of the big problems that physical therapy is trying to work towards. If you go to med school, you can sign a contract to have all your school paid off as long as you come back to somewhere like Plainville or Victoria or Stockton like that. Physical therapy, you don't qualify for that. You can find other programs that help pay a little, but you're not going to find a program that'll pay it off like what a medical student would. So the profession is trying to work on things like that, but student loan debt is a big deal after PT school. It's very expensive.
If someone's frugal with their money, they probably can budget and get that taken care of over time. So, which is important.
And if you get some good scholarships and apply for scholarships, those are always available. So
right, that's good. How about what advice, or excuse me, what is it like working with people that you might know from the community you live in? How does that play a factor?
Well, I think it's a nice thing because you already know most of their history and their background. You don't have to waste all your time asking all the questions. But We do see a lot of the same people and over again, but it can be challenging if they know your mom and your dad, and then you say something to them they don't like, they could go say it to your mom and dad. That kind of stuff happens. But also, it's one of those things, I've gotten to work on previous teachers, previous coaches, things people you never thought you'd see again. And now you're helping them through a phase in their life, which is really nice because they helped you through a phase of yours. So there's a good pro and con to both, but I say the pros outweigh the cons.
Sure. Well, that's rewarding, isn't it? I
Mhm.
mean, do you have time in your day to, do things within your community as well? Get involved outside of the practice? I mean, I'm thinking of hours of work and.
Mhm. So I currently do 4 10s. So I work Tuesday through Friday from 7 to 5:30 essentially. And then I have my Mondays off. So yeah, I have a day available to kind of do what I want, stay engaged in the community, things like that. But yeah, you're scheduling, you can kind of make work about as much as you need to. I mean, no one's going to tell you you shouldn't go volunteer. They'll find time to do that. So
Sure. And I don't know if this is a possibility, but I always think about traveling nurses, and we'll talk about nursing later in the day, but is there opportunities for somebody in PT to be in a traveling capacity at all? Okay.
Yep.
How does that
Yep.
work?
So essentially, I had a couple classmates do that. You graduate and then you take a job with some company that's what you would call like an alliance company, which they're global, and then they hire you for contract work where you just travel wherever you're needed. So, Aegis is one of the big companies around here. So if you work for Aegis, you work for them, but you get to kind of, not always, but you kind of pick the region of the world you want to be in, the United States. So if you want to be on the West Coast, you say, I want jobs on the West Coast. I want a job on East Coast. Central state's fine, but essentially you pack up all your stuff and they send you someplace for 3 months. You do your 3 months there. It's usually when someone goes on maternity leave or they lost a therapist and they're trying to find a new one, they can't, they'll send you in to do, cover things until they have someone covered, then you're out of there. But yeah, you kind of live from place to place. They help pay for your stay, they help pay for your food, and they pay you on top of it. So I had a lot of friends do that because they would go to a place and live with a friend, and then they kind of just took the extra money and put it back towards student loans. So
Sure. Yeah. A couple other questions that have been coming in. One from Otis Spice in school. What is the best and most challenging parts of your job?
probably the best is, there's a lot of people that come in here, at the extreme limits. We have people that come in that can't walk anymore. They're paraplegic, things like that. After a year or so rehab, they walk back out of here, and just to watch the process of someone going from completely dependent on somebody to independent on their own is probably one of the most rewarding things we have. So that, and, we get the high school kids tear ACLs, they think their life's over, rehab them for 6 months, and they're right back in playing the sports they love. So it's really just a process of seeing someone come in, broken, and then we try to repair it and get them back to a level they were better at before. So
Awesome.
the worst part is documentation. We have to sit in this office and document for hours on end. So that's the worst part.
Right. Documentation, there's insurance involved. You're dealing with a lot of, I'm going to say, red tape. So, and there's that part, I think that's important for students to understand that that's going to go with any kind of job really that you have, whether you're owning your own business or whether you're, hired by another company or organization. There's always going to be documentation, and of course, like you're saying, some of it's really extensive. So, keeping good records is really important. And I think that tells me that, paying close attention to detail, working on your work ethic, those kind of things while you're in school can be beneficial as well. So,
Absolutely.
Are there any other questions from any of the schools that haven't put it in chat? If you'd add that to chat now, we still have a few minutes before we transition. Excuse me.
Anybody have questions? I know we were in midstream. What do you say is undergrad? Does anybody know?
What was the question?
Something about undergrad.
Oh.
did you do, let me just, I don't know if the question's been, I don't see it in chat yet, but could you talk about your undergrad studies? Did you do a biology degree, or what did you do for your undergrad?
Yeah, I did a health and human performance degree, which you can use to personal train, go on to a higher level degree, exercise physiology, all that stuff. It's kind of a global degree for that. And then I got a minor in coaching. And then I actually went ahead and got a master's degree as well. And I have a master's degree in health, physical education, and recreation. So I kind of have a global aspect on education for what I do.
Wow, that's really great. Awesome. Here's a question. This is coming from Osborne. When being a PTA, do you have to work under a PT? So if they
Yes.
become okay.
Yep. So if you don't want to do the full-fledged PT, PTA is an option that's wonderful as well. It's a good paying job. You can kind of go where you want as well. But you have to work under the direction of a physical therapist. Now, they don't always have to be in the building, but your license is underneath them to be able to practice what you do because you work under their plan of care.
Do you have an idea of what a PTA, a range of pay,
Yeah.
a physical therapist assistant? I should confirm that with everybody so they know.
After 2 years of school, you could, depending on where you're at, again, it ranges, but I'd say median wage is going to be between probably 40 and 45. Higher end people can make 60, lower end people are making 28 to 30. Just depends on where you're at.
Okay. Awesome. Okay, can you talk about, can you go to community college to get the physical therapy assistant side? What part does that transfer on to a 4-year college if you decide to go on? How does that work?
So Colby has a physical therapy assistant program. That's Colby Community College. Hutch has one. I can't think. I know Washburn's got one, but Washburn's is part of a 4-year school. So if you want to go in, you can kind of trickle right over. But everything you do in your undergrad and your community college stuff for your associate will transfer right over to work on towards your 4-year bachelor's. So we have quite a few kids do that. They'll go through the program at Colby, get their 2 years, and they go right into school at Fort Hayes, finish their 2 years out, and then they've got a bachelor's. And while they're working on their bachelor's, they can be working as a PTA in the meantime. So
yeah, when I was at Colby Community College years ago, I had some friends that were in the PTA program and loved it. So I know they've done a good job there. So, well, Dr. Kriley, thank you so much for your time. We appreciate it. We know you're busy, and you've given us some invaluable information. So we thank you for being with us this morning.